Hi, my name is Rose Velez-Miggins, and I'm excited to share my project, Understanding Multidisciplinary Provider Preparedness for Sexual Health and Wellness in Disability Care. This literature review explores how prepared professionals across healthcare, education, and the mental health fields are to support sexual health and wellness for people with disabilities. My passion for this project started over 2 decades ago when I began my career as a recreational therapist, just as the concept of whole person care was gaining traction. But even then, I noticed how sexuality, relationships, and intimacy were often left out of care conversations. That gap became impossible to ignore. Years later, I pursued a career in marriage and family therapy to better understand and support the relational wellness and needs for people with disabilities. Now, nearly 20 years later, I'm still seeing the same insufficiencies in inclusive and affirming whole person care. The goal of this project is to identify and synthesize research on provider preparedness to highlight the knowledge gaps, elevate best practices, and advocate for a more standardized delivery of sexual health and wellness education in disability care. To conduct the literature review, I examined peer-reviewed research across disciplines, including empirical studies, scoping reviews, and meta-analysis. My focus was on understanding the current state of provider preparedness, including the availability of training, perceived barriers, and reported needs. What I found is that most of the research uses qualitative methods such as surveys or interviews, and most of it relies on self-reporting, which introduces bias, and there's very little longitudinal follow-up to track long-term impact of service delivery. The research revealed three key patterns. The first is that providers are absolutely lacking training. Most professionals feel unprepared or uncomfortable talking about sexual health and wellness with clients who have disabilities. While they may recognize the importance of supporting sexual health and disability care, most feel unprepared. The second is that barriers exist at every level. Personally, providers may fear offending someone or they may hold unconscious bias, including the pervasive societal myth that people with disabilities are asexual. Institutionally, there's often no curriculum or guidance on how to address sexual wellness and disability care, and if there is existing education, it tends to center on risk reduction, like preventing abuse or unintended pregnancy, rather than promoting pleasure, consent, identity, and meaningful relationships. And systematically, funding remains limited, especially for marginalized populations, reinforcing the silence and stigma. And finally, the third key finding is that the voices of people with disabilities are missing. Most studies rely on provider perspectives rather than including those most affected. So, where do we go from here, and how do we close the gap? The literature recommends evidence-based trainings like sexual attitude reassessment, or SAR, as well as long-term certification programs. Institutions must provide policies, mentorship, and support systems that encourage open and affirming care. And most importantly, we need to center the lived experience of people with disabilities in all aspects of care and training. What surprised me the most about this project is that providers overwhelmingly want to do more. They see the need, they feel the gaps, but they feel held back by outdated training, institutional hesitation, or the fear of saying the wrong thing. The willingness is there, but the support is not. This project was my first experience in research. As a first-generation college student, opportunities like this once felt out of reach. But thanks to the supportive community at Widener University, especially Dr. Wells, I've grown both personally and professionally. I'm proud that this work brings together insights from multiple disciplines to shed light on a topic too often overlooked. I'm excited to continue the research on the ground through interviews with providers and meaningful input from the disability community to ensure that future recommendations are not only evidence-based but informed by lived experience. The conclusion of this literature review is that we need more than just awareness. We need structured, interdisciplinary, and affirming training models that center the full humanity of people with disabilities and reflect the diversity of their lived experiences. Provider preparedness is more than just technical knowledge. It's about comfort, confidence, and cultural competence. To achieve that, it would be beneficial to implement continuing education and certification programs to address the discomfort, dismantle the biases, and ensure that people with disabilities are included in every aspect of planning and practice. Together, we can move forward to a future where sexual health and wellness are recognized as essential components of care for people with disabilities and not just afterthoughts. I hope this work encourages continued advocacy, collaboration, and innovation across disciplines so that all people can access inclusive, affirming, and equitable support. If you're interested in this work or you would like to collaborate, I invite you to connect with me through my nonprofit, National Council on Relationships and Disability Incorporated. You can reach me at rose@ncorad.org or on social media at ncorad_org. Thank you for your time, your attention, and your shared commitment to creating change. Have a great day.